Well, I'm glad because I was answering about the first part of the
Did not notice. I
So you
didn't
watch it from the
notice.
beginning.
Yes,
Oh, interesting.
I didn't notice at
Well,
all.
that's good. Anyway, welcome, ladies and gentlemen, to another episode of the Women's Health Podcast with Kim and Dr. C. I am Dr. Leroy Campbell, otherwise known as Dr. C, the Women's Health Doc. And of course, I am with my lovely co-host, Miss Sis Kimberly Hoffman Reed, the Women's Health Physio. Kim, how are you doing?
Hello. I am good. How are you doing? Happy for another episode. You know, it's always lovely chatting with you.
And as usual, have my tea. You're gonna ask me what having tea.
I hope it's not so water, it's not hot water, because that's not tea, doc.
Well, that was the last time, right? But I actually have some ginger here. I don't know if ginger is a good thing to be drinking when you're recording. Is that a good thing, Kim? 'Cause doesn't that kind of
Get gassy?
your vocal cords and stuff?
I don't know.
It's a bit harsh.
Hear some, probably, but you know your voice.
Yeah. It's always husky.
Your voice used to it, doc. I'm sure you'll be
always being
fine.
abused, right?
I'm telling
Yeah.
you.
So what we're talking about today.
I think we were hinting on the pelvic floor last week.
Oh
Talking
yeah.
about
So yes,
some
I was sharing
information
with you
related to
that
pelvic floor.
yeah, I was sharing with you that I was asked to do a talk with some of the physiotherapists at the hospital.
Oh,
They had
nice.
invited me to do a talk, and interestingly enough, the topic they wanted to speak on was pelvic floor dysfunction. And you know what was going on in my mind, right? Because I'm saying I know the right person to really who should be doing this talking about. Anyway, I won't get into I won't get into my feelings today.
Oh,
But
doc.
I won't get into my feelings today. But I knew the right person to do the talk. So
I
I said, all
don't
right,
know
guess
when
what?
I'm going to live this down.
But anyway, I think we can chat a little bit about that, right?
Yes, we
And then
can.
maybe if and of course if it would allow me to be able to share our discussions with them. So even if you're not there to in person, we can they
Can
can
send
hear
them
your
to
views on it,
listen.
right? Yeah. I
Absolutely,
think that would be cool.
absolutely.
That sometimes the pain syndromes related to gynecological disorders are not just limited to the disorders themselves.
Right.
So when we talk about things like endometriosis, women, apart from getting the inflammatory changes and the pain related to the inflammation of the condition, over time you actually get pelvic floor dysfunction and compensation in other
Mm-hmm.
parts of the body that will manifest with chronic pain, chronic pelvic
Absolutely.
pain, chronic lower back pain, such that, Kim, even when we treat the condition, meaning the
They still have the
endometriosis,
issues.
sometimes some patients still have issues going forward. So probably we can deal with that. So let's start with the signs and symptoms, and then I'll probably see where it goes from there.
All right. We're talking about pelvic floor. We have to talk about what is the pelvic floor,
Right,
because so
right.
many persons, they don't have a clue about the pelvic floor. I had one lady come in this week and she's just like, when you say pelvic floor, I thought they meant I was going to get down on the floor and do some exercises.
Oh,
I kid you not. That's literally what she said. She thought I was going to put her on the floor. I will do some exercises and that will help her. And
right.
I can understand, I understood like that many persons don't know what the pelvic floor was, but I at least thought they knew it was some part of the body,
Mm,
and it was kind of shocking to me, but I do understand that it's not something that's talked about frequently. And I can understand somebody just not knowing. So the pelvic floor is basically the group of muscles responsible for holding or supporting the organs, internal organs, the female or the reproductive organs, both male and female, because men have a pelvic floor as well. And in
right.
a sense, it is the base of your core, right? So it is one of the main functions of the pelvic floor is to support, right?
Right.
And it extends from the pubic bone. So that's the bony part. For females, the vagina, and for males, the pubic area, to the sacrum, that's the bone at the, right at the butt crack, that bone that you feel right there. It extends
Mm-hmm.
from the pubic bone to the sacrum. And it's like kind of like a hammock. I like to think of it as a meaty
Tailbone.
hammock, right?
Mm-hmm.
From the tailbone to the pubic. And
Mm-hmm.
it's, think of it like a hammock, a meaty hammock just hanging there. And yeah, it is hanging, but it's how it hangs that can be a problem, or can be perfect, can be ideal, right? So this in a sense, muscular hammock is meant to, for females, hold up the uterus, the bladder, the rectum, and the basically the opening for the vagina, the urethra, and the anus, right? So that we can get things out as well.
Right.
So, in essence, based on just what I've said, you understand that this is pretty important. It's a pretty important muscle. And it's important for you guys to remember that it is a muscle. And it's a muscle like any other, and has similar features to muscles, right? Meaning that they can get stronger, they can get weaker, and muscles that are weaker are harder to maintain and perform their functions, right?
Right.
And that's usually when it becomes a problem in terms of pelvic floor dysfunction and pelvic floor issues, when the muscles aren't maintaining their strength, and therefore it's unable to complete the function, and the main function being supporting the organs.
Right.
So you spoke about referred pain and having issues with the pelvic floor and feeling it elsewhere. Why would this happen? So the body is an amazing, amazing, like you just know someone had to create it because it's just so perfect. The body has a way of just adapting. So you
Right.
have somewhere that is weak and not functioning like it should. And let's step away from the pelvic floor and let's just think about just in general. We have somewhere in our bodies, let's say the shoulder muscles, they're not operating like they should. And you have back muscles helping. You have muscles from other areas of the body helping. So in terms of the pelvic floor, what typically happens is that when the pelvic floor, because the role of the pelvic floor is so important, you have one, the ligaments that will help, but you also have some bigger muscles close by, like your hip muscles, your glutes, right? Your core muscles, they'll take over the function. They'll try to help the pelvic floor to maintain the organs by doing more work. And over time, doing that work changes your other movement patterns. So if you're the muscle that's supposed to be helping you with walking, helping you with your pelvic floor, then another muscle is going to have to help you with walking. So you're changing your walking pattern. You're walking differently. You're lifting objects differently. You have, in essence, changed your movement pattern to allow the other muscles to help the pelvic floor out. So
So
after doing,
essentially the all of these are interconnected, the muscular systems of the body. And you're saying
right,
that if there's dysfunction in one place, then you're going
somebody's
to
going to
have
take over.
something else compensating. Yeah.
Right.
And we've known that for some time, even in the context of muscular injuries elsewhere. So like,
Yeah.
if you have injuries around the knee, then
Mm-hmm.
after a while you're gonna find that persons you develop hip problems or spinal problems if they're limb issues. So so I guess it
Precisely.
makes perfect sense that if there's problems with the pelvic floor, it's gonna it's gonna affect other areas.
Precisely.
Before you continue on the trend of how that adaptation, as you would call it,
Mm-hmm.
occurs, or
Mm-hmm.
maladaptation in this case, because it's
Maladaptation. Yeah.
adapting in a bad way.
It is.
Um, what are some of the issues? Because somebody who's listening is probably wondering, how would I know? How does somebody know if there's pelvic floor dysfunction? How would it manifest? What are some of the symptoms that would indicate that there's a problem with the pelvic floor?
Right. So 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 I was getting to that through saying one of the key things that you notice is the disturbance in someone's gait. And then you begin to see that something is happening somewhere else. And it's not because of how they're walking or what they're doing. So you know that something is wrong. And the first signs that you usually realize that something is wrong with your pelvic floor, it's your ability to, when you're breathing, you might start to realize that when you sneeze, which is forceful exhalation, when you sneeze, you laugh, you cough, you might not necessarily lose urine, but you might feel pressure in the pelvic floor. Whenever you sneeze, whenever you cough, whenever you laugh, you start to feel a bearing down sensation in the pelvic floor. And
Oh,
that's
okay.
when some persons might not notice it because we're so focused on things outside that we don't really notice what's happening in our bodies. But that's usually the first sign. And then when we miss that sign and it continues, we might start to notice that doing these same actions, coughing, sneezing, laughing, we start to be unable to hold our urine. So you might say, I just sneeze and a little urine come out. Or I just cough and a little urine come out. And I don't understand why this is happening. That's usually when persons start to seek help. So they
Well, that's
miss all
interesting.
the other
So,
signs before
I mean, this
that.
is, I don't want, I sorry, you know, I have to kind of, because this is good stuff, and I want to make sure that we're getting it, because you're saying that
Sure.
even before you get to the point of having, you know, things like incontinence or urine loss, there are subtle features. So you mentioned if you're
Subtle.
coughing and sneezing, you feel it in the pelvic floor. Is it that because I know I have patients, for example, who will say they cough. Sometimes they feel like a pain in the under there, they would say, between the vagina and their anus, right?
Right.
And
Right.
one of the things that, you know, I suspect quite often that's related to spasm of the pelvic floor. So is it pain like with the coughing and sneezing, or is it a just feeling heaviness, or is it a combination of factors, or does it vary?
Right. So it varies. So for someone who is suffering from laxity of the pelvic floor, meaning that the pelvic floor is unable to support the organs, they might just have the bearing down. For someone who the pelvic floor dysfunction is due to tightness of the
Mm-hmm.
pelvic floor muscles, they might be having spasms, which would be
Okay.
painful with the coughing and the sneezing.
So it just
Right.
depends
So
on
while
the
the
dysfunction.
Right. So while the pelvic floor is trying to do what it's supposed to do, that quick action causes spasms, which
Mm.
in turn causes pain. So it depends on what is causing the pelvic floor dysfunction in the first place.
Okay.
Right? Mm-hmm.
I see what you're saying. Yeah. Mm-hmm.
Yeah. So so other symptoms that persons may notice that's also very subtle, because it's very important that persons pick up on the subtle symptoms
Right.
before we get to the really hard ones, the ones that are harder to treat, meaning, you know, you have the
Right.
prolapse when the organs are actually falling out, when you have severe incontinence where you're actually unable to hold your urine, right?
Right.
So you might notice that you go to the bathroom and you have issues initiating the pee. So you really feel like you want to go, you run to the bathroom, you get there, you sit on the toilet, and you have to wait a few seconds before the pee actually comes, right? There's another subtle sign that happens quite often. A person will say, that was like that, that's been happening for years,
That's
but they didn't know
interesting.
nothing was wrong.
You know, I don't know if you've heard that before, but you know, when somebody waiting to start urinate, you know, they make that sound to kind of bring.
To
I don't know.
bring
I
it
don't know.
on.
I guess that's what she's trying
Yeah.
to do.
Or they might turn on the pipe. But the funny thing is
Yeah,
that
that's it.
they
Yeah.
were rushing to the bathroom. So they know they
Oh.
really need to go. But then
Mm-hmm.
they get there and it's not coming readily.
Mm.
It's one thing when
Interesting.
you go to the bathroom and say, I don't know if I really need to pee. I'm just gonna sit here. Probably you didn't need to pee. But for
Right.
persons who they know they needed to pee, they get to the bathroom and they're sitting down, waiting for the pee to come.
And it not coming.
And
Wow.
it's not coming. So that's usually linked to tightness of the pelvic floor, which is very frequent. Many persons think that the biggest issues with pelvic floor dysfunction is actually laxity, but it's not. And I want to get back to gait, but I want to talk about some more symptoms because the biggest issue is because of your gait. And I can't wait to get to that because that
Oh,
link
wow.
is
I'm
crazy.
excited to hear that too.
That link is crazy. But yes, so that's a major symptom. And another big symptom is constipation.
Mm-hmm.
Constipation. So persons walk around, how often do you have any issues with passing your bowl? Patients come in, do you have any issues with passing your bowl? No, no issues. How often do you go? Like twice a week. Twice a week.
Oh,
What do you mean twice a week? That's how it's always been.
oh. And but most of the time as clinicians, certainly we link that more to that. So like one of the first things I would think about now is what is the person's fiber content in your diet, are you having enough fluids, etc., etc. I probably would not
And it is linked to
entertain.
diet.
I know. I'm just saying I wouldn't bring up pelvic floor in it, but
But here
it's all
why?
linked because if you're
Yes.
straining all the time, after a while you develop pelvic floor dysfunction, right?
Exactly. Because you
That's
have chronic
brilliant.
constipation, then you mean you have chronic straining, and then you
Right.
start to have issues. You have hemorrhaging. You have the pelvic floor always
Mm-hmm.
bearing down because you're
Mm-hmm.
forcing into the pelvic floor. So you're already pushing everything down into the pelvic floor. So
Wow.
you're starting the problem right there. So once you have chronic constipation, it's almost always linked to some amount of pelvic floor
So that's
dysfunction.
interesting. So it's not necessarily that the pelvic floor dysfunction causes the constipation, is that the constipation leads to pelvic floor dysfunction, which in turn kind of just exacerbates the whole problem. So it creates a cycle.
Right.
Wow.
We don't even know if it's
Mm.
the egg before the hen, but we know
Right,
that
right, right,
they're
right.
both linked.
Absolutely.
They're
That's
both
beautiful.
linked.
Hmm.
Yes.
So I like talking to
So
smart people now.
so these are things that people are going through daily in their lives that are like, no, it's not pelvic floor. But recently I was telling you about a book that I'm reading on evidence-based pelvic floor physiotherapy and
Right.
how it came about, how pelvic floor physiotherapy came about. And I think it's Bump and Norton are the authors who said the pelvic floor has three states, right? A
Mm-hmm.
normal state, that means the pelvic floor is normal, you have no symptoms. The second state is the pelvic floor isn't normal, but we still don't have any symptoms. And then the third state is that the abnormal pelvic floor starts to show symptoms.
Mm.
So, majority of persons are in the number two state, especially once they've experienced childbirth.
Mm-hmm.
They're in the number two state. So they've already the pelvic floor already has issues, but because these women are typically, or these men, they're typically young and fresh and they have lots of collagen. The ligaments in the pelvic floor, they're capable of holding up, doing the work of the muscles. But
Right.
once women hit menopause and they start to lose estrogen, they start to lose collagen, elasticity reduces, and then they start to see the issues that they've had for a while, but
From
now it's
before.
right, but now it's
Absolutely.
exacerbated, and now you actually have symptoms. So that is why it's so important that once a woman experiences childbirth, she actually seeks out a pelvic floor physiotherapist to get her on the right path. It doesn't mean that she's coming to a pelvic floor physiotherapist weekly, but they've assessed her, they've seen where the muscles are, what the muscles are doing, and put her on a plan that she might need a few sessions and then to continue on her own to ensure that she's able to maintain her pelvic floor throughout her life.
Yeah.
So
I mean, I
yeah.
think that's amazing stuff, Kim, because first of all, with what we call decompensatory factor. So quite often the initiation or the insulting factor occurs very years, even
Mhm.
decades before the
Before.
manifestation of the symptoms. So you mentioned childbirth, you mentioned the chronic constipation, persons who have asthma or chronic
Mhm.
lung disease or
Chronic
chronic
cough.
cough.
Mhm.
These are all factors that are initiating the insult to the pelvic
Right.
floor. But because the organs have different levels, we say a three-tier level of support, where you have the muscle, you have the fascia, which is a connective tissue that's connecting everything,
Right.
and then you have the ligaments.
Humans.
And then the latter two are compensating for
For
the
the
muscle that
muscles.
is already dysfunctional. So the woman
Right.
doesn't have symptoms until later on, as you said, when the ligaments become lax, as estrogen levels fall, then now it all becomes revealed later in life. So the
Right.
importance of having a preventative approach to these kind of issues is something that we have to emphasize, and hence the reason I wanted to summarize that.
We have to emphasize it because what happens is that the organs, the pelvic floor, once it's damaged to the point where you're having symptoms, physiotherapy becomes increasingly less effective.
Mm-hmm.
So
Yeah.
then we have to be looking at
So
invasive
we're looking at
treatment
more invasive treatment
options.
options, right?
Right.
Absolutely. Okay.
Right.
All
And
right. So
and then
you're sorry. Go ahead.
because our pelvic floor is so linked to our womanhood, once we start to have issues there or self-esteem, how we feel about ourselves, it's greatly affected. So while you can manage the pelvic floor issues before you're having severe symptoms, it's the best time.
Mm-hmm.
It's truly the best time.
Right. So you mentioned, feeling some effect, feeling the pelvic floor sagging or spasming as a symptom. You mentioned in response to like coughing or straining. You mentioned um, leakage, or what we
Right.
call in the medical field stress incontinence,
Mm-hmm.
right? You mentioned constipation, right?
Mm-hmm.
Are there any other symptoms that could indicate the presence of pelvic floor dysfunction?
Yes, back pain. It's one.
Mm-hmm.
Is one that's quite frequent. Um, Pelvic pain, pain in the pelvis, or the SI joint, the sacroiliac joint. It might
Mm-hmm.
also cause pain and hip pain as well. Hip pain as well. So pain is one classic sign of pelvic floor dysfunction. Um, breathing patterns.
Mm.
Breathing patterns, it's a big one. And that is usually my first sign that I'm looking
Right.
for when a patient comes in. I'm checking how they're breathing. I went to a mommy retreat last Sunday and I yeah, it was very good. It was put on by a friend, Samika.
Oh wow,
Yes,
yeah. So,
lactation consultant. But yeah, so I was instructing the mothers on engaging the pelvic floor through breathing. And silly me, because I hadn't talked to a group of mom in a while. I was just like, take a deep breath in, exhale, and make the sound. And I'm going on and on. And they're like, oh, not feeling anything. And then it hit me. I'm like, okay, when you inhale, what are you doing with your tummy? And then everybody's like, I'm pulling it in. And I'm like, and then what are you doing when you're exhaling? I'm pushing it out. So I'm like, oh, yeah, of course, Kim, of course. Because so often when you ask someone to take a deep breath in, what do? They
mm-hmm.
suck their tummy in. Deep
Right.
breath in. They pull
I'm doing that
everything
right now.
in. They pull everything in when
Right.
it's actually the opposite.
Oh,
It's the
cool. Wow.
opposite. And then you might see the flaring of the ribs. So once you see
Right.
the flaring of the ribs, you understand that when they're engaging the core, it's quite difficult because now the alignment is off with the
Mm-hmm.
diaphragm, the ribs, and the pelvic floor. It's off. So it's hard for them to be able to initiate contraction of the pelvic floor. So they might be confused. I can't feel it. I don't understand what you're telling me to do. There's no connection there. And there
Mm-hmm.
isn't because the alignment that is required to maintain the connection, it's off. And that's usually because of the same compensations that we mentioned before.
Oh, that's
The
interesting.
shoulders not doing what it's supposed to, so the back's doing what it's supposed to do, so the ribs are flaring, and everything is connected. Everything is connected. So it's important that you see the right medical professional to look at these aspects as well so that we can see the alignment, so that we can see what is off and what you will need to work on before we even get to the pelvic floor. So a lot of times persons come into my office and they're like, but you're supposed to be focusing on pelvic floor. And I'm like, yes, but you have tightness in your shoulders, your back, upper back muscles, they're not, they're severely weak. So they're not taking part in anything that they're supposed to be doing in terms of engaging, keeping your scapula on your upper back. So now we have to fix that in order to fix your alignment, in order to make sure that your ribs and the pelvic bone is aligned so that the pelvic floor can work optimally. So the link is very, very, very important, and breathing is important. And it's usually the first sign that a pelvic floor physiotherapist will pick up to see that, yes, this patient actually probably has something going on with the pelvic floor as well.
That's interesting because, you know, we as gynecologists have long been aware of the fact that women lose their awareness. Not as women, but because we the pelvic floor disorders tend to be more stark in terms of how it presents and the symptoms in women. We talk about prolapse, and so I'm sure we'll get into that a little later.
Yeah.
We've long known that for women there is a loss of the awareness of the pelvic floor, and the older a woman gets, the less aware she is of the pelvic floor. In fact, that's one of the, when we begin to talk about therapy in terms of electromyographic stimulation and all these things, that a lot of these biofeedback mechanisms that we use for treatment have been designed around allowing women to rediscover the pelvic floor. So sometimes it's not enough to just tell them. But you're saying now that it's not just because I've always said, okay, it's neurological.
Yes.
So it's just the nerves being injured during childbirth and pregnancy affecting the sensation. But you're saying now that it's probably more than just the pure neurological. It's connected to dysfunction elsewhere.
It's connected to dysfunction elsewhere. And then we add the neurological dysfunction on it. And that's why I prefer to treat women before pregnancy, because especially when they had this dysfunction before pregnancy, it is so hard to retrain the pelvic floor after, simply because the concept is so abstract. It's not impossible, but it's much harder after pregnancy for women to appreciate and understand what the pelvic floor muscles are and how to engage them.
So, all right, because somebody's out there listening and they're saying, boy, all right, if I thought pregnancy was the main issue, I thought that was what was the factor that is affecting the pelvic floor. So why would I need to go before?
Right. So why you would need to go before is because, one, as I just mentioned, it is easier for you to appreciate and engage your pelvic floor before pregnancy, before, as Doc mentioned, the neurological implications of pregnancy, meaning that the baby is growing in the uterus, pressing on nerves that are used to stimulate these very muscles, right? These nerves are very important to these muscles functioning as they should. And once you go through pregnancy, after 9 months of the baby compressing these nerves, it's very hard for you to visualize, because this is it's not muscles like your arm. It's not muscles like you can say, take your arm up, take your hand up to your shoulder, and that's how you engage your biceps. I can't tell you the same thing for your pelvic floor. I have to tell you to, one, localize this muscle that you cannot see on the inside and try to engage it. The concept is much harder after those the nerve damage. And then if you also had dysfunction before pregnancy, you probably were already out of alignment. You probably already had a hard time engaging the pelvic floor muscles because of other dysfunctions elsewhere. So that compounds the problem. Now, before baby, or even during the early stage of pregnancy, before that has happened, it is still probably going to be a little challenge to engage these muscles, but it will be much easier than after the 9 months, after the delivery, after going through labor, to engage those muscles.
Well, but then I mean, so definitely I can understand with the effects of pregnancy to prepare, because of course this comes under now what we call pre-pregnancy care and
Pre-pregnancy.
planning.
Right. Right.
um you know, that you're preparing for the trauma that the pelvic floor is going to undergo, and
Right. And you
naturally,
strengthen these muscles.
right, so any muscle that is injured, and if it was in good the condition before the injury,
Right.
oftentimes predicts how well the person recovers after,
Right.
logically. But then now somebody may be asking, so every woman needs to go and see a pelvic floor physiotherapy before they get pregnant. I mean, is that what you're saying, or is it that there's
I'm actually
specific? Because
saying that. I'm actually
actually
saying
saying
that.
that.
I'm
Oh,
actually saying that,
okay.
but if it's okay. So yes, I truly do believe it with all my heart, and I wish that was the way it went.
Right.
But if
I
it
mean, when
doesn't,
you and I
it's
work together, I refer my patients to consult with you, right?
right.
Most of the time, it's not before pregnancy though, because
It's
it's
during.
unfortunately
People
that
don't plan
we
for
haven't
pregnancy.
gotten there yet. Most pregnancies are unplanned. So early in the
Right.
pregnancy, certainly by before 28 weeks, I'll have them come and see you, and you do an assessment and give them some advice and whatever. But then, is there a way, like which woman would you say, all right, this person
The
probably should really be coming
persons
in
who
for
should.
assessment? Because I don't think, I'm not sure as yet that most health services would be at a place where every woman who is going to have a baby will get it.
We're
Hopefully we get there soon. Hopefully we
hopefully
get
get
there
there,
soon.
but
Um,
we're far from it.
yeah, but
We're
there
far
must
from
be
it.
there are a subset of women who you would
Yes,
say, so like for example, if you have women who have had previous pregnancy, previous birth trauma, so forth, there must be a subset of women that we can say, well, if you fall into this category, then you're probably one of those women that even if it's not readily available, you should seek it out.
absolutely. So one, if you're already having any of the symptoms that we've mentioned before, if you're
Mm-hmm.
feeling the bulging in the pelvic floor, if you're having incontinence, if you're having constipation, if you're having pain in the pelvic floor, if you're having back pain, hip pain, SI joint pain in the early stages of pregnancy, these are good indicators that you should definitely be seeing a pelvic floor physiotherapist. If
Mm.
you're having multiples, so if it's a multiple pregnancy, then you know you'll be having
Twins and triplets.
right, we're having twins or triplets, or how high can it go, doc?
Well,
Um, then
sky's the
you
limit.
then you definitely need to consider seeing a pelvic floor physiotherapist, because then you know you'll have additional trauma on your pelvic floor, on your abdominal muscles. So the more pressure you'll have on these muscles, the greater the chances of injury. So definitely, I would say these are the persons who should consider pelvic floor. If you already have an underlying condition that predisposes to pain, then I would definitely consider pelvic floor physiotherapy. Um, the neurological patients whose conditions are generally exacerbated by pregnancy, like MS, neuromyelitis optica, I definitely recommend that these patients seek pelvic floor physiotherapy before pregnancy, one, for manage the pain, and two, to help them with the pelvic floor dysfunction, preventing pelvic floor dysfunction. Did I miss anybody?
Mm. So pretty much any patient who is having symptoms of pelvic floor dysfunction, which we mentioned
Pre
before,
pre
um,
under pre-existing conditions.
if they're having exit pain,
Mm-hmm.
whether it be back pain, pelvic pain, um, if it is that they have underlying medical illnesses that may affect neurological and muscular function, and then of course patients who have had past obstetric, previous deliveries, especially, I would say if you have
If
a
it's
large baby,
traumatic.
if you had
Mm-hmm.
forceps or some
Yes.
kind of assisted vagina delivery, you had an episiotomy done, or if you probably
Or
have had or
C-section.
a cesarean section, that was,
Yeah,
yeah. So then you'd probably
absolutely.
that would be certainly a group that if we're gonna filter down would certainly benefit from pre-pregnancy as well as prenatal pelvic floor physio, at least a consultation, eh?
At least, at the very least.
Kim,
Because
listen, I don't understand, how is it that you're talking about pelvic floor dysfunction? I don't hear nothing. I don't hear anything about sex. Because usually once we start talking about pelvic floor,
I
the
always get to say,
first thing, one of the first things that come up is sex. So I'm surprised that we got this far
I,
into a discussion
we did.
without
How did
mentioning
we?
that.
How did we do that? How did we do that? 'Cause that's one of the signs. That's one of the first
Absolutely.
signs.
Yes. I need to
Pain
tell
with
it, tell
sex.
it.
Pain with sex is usually one of the first signs. Pain with insertion,
Mhm.
pain during the act of sex, trouble having issues with orgasm, meaning you're not orgasming, or pain with orgasming. These are usually
Mhm.
signs of pelvic floor dysfunction for both genders, male and
Mhm.
female.
Male and female.
Right,
And
male and female.
before we even develop on the pain, also, so the pain probably is an indication related more to spasm and hypertonicity of the pelvic
Mhm.
floor. But then on the other side, you have the
It
laxity
could,
effects, where
right,
some women may have gaping of the vagina, or they may find that there's what they call vaginal farting, that noise, gas
yeah,
escaping during intercourse, or the penis
or the
falling out during intercourse, or just generally a lack of sensation
right, and
or
not feel it's
feeling
not
in
feeling the
intercourse.
same, or
Right,
the partner's complaining of feeling things that they never used to feel before, which
right.
might can also be signs of the start of a prolapse.
Prolapse, right,
So
right.
right, so these are some of the signs that you can look out for as it relates to sex and
Mm-hmm.
pelvic floor dysfunction. It's funny because in our culture, in our society, pain with sex is deemed normal. If you listen to the
Mm.
songs, if you see what they're saying on social media, you just assume that, oh, pain is definitely a part of it. But I'm here to tell you it's not normal. It's
We understand that sex is something that's very, very important.
yeah,
And I mean, say for most people, for most people,
almost for
and
almost
so
everybody.
yeah, so consequently, it's very important that we bring up that part. You know,
It is. How did we forget it?
yeah, I don't know. We kind of were, going through different things. But anyway, yeah. So those are some of the symptoms. Eh? You mentioned the symptoms and stuff. Anything else that you wanted to get into?
Yeah, I wanted to get into the gate. I
Oh, you want to
wanted
get into the
to
gate, right? Yeah.
speak. So we're talking about gait, we're talking about how you walk, right? So we there was an article a few years ago comparing sitting to smoking, to the hours of sitting being comparable on your health to smoking. And we just finished a decade of smoking kills and putting literal side effects of smoking on the cigarette cartons. And we actually have a generation of kids who don't smoke cigarettes at all. I mean, we've
Hmm.
started probably another problem with vaping, but just to highlight how serious and detrimental cigarette smoking is to your health. And when someone's willing to compare another act that we're doing daily to smoking, you're like, whoa, what? Are you serious? This is a big deal. This is a
Right.
big deal. But sitting really does have a lot of implications on our musculoskeletal structure. So I'm not getting into the whole systems, not today. I'm just talking about the body and the function of the body. So we find that a lot of our jobs have us sitting. If you work for 8 hours, you're sitting more than 80% of the day,
Tell
right?
me about it.
And this can result in muscles tightening, muscles becoming weak, right?
Hmm.
And these muscles typically are the muscles typically involved are the pelvic floor, or I like to call them friends of the pelvic floor, right? And so while we're sitting daily, we have these muscles weakening. And a major one, it's the gluteus medius, right? This muscle is responsible for allowing the opposite hip muscle to move up, for the hip to move upwards while we're walking. So as we're walking, the muscle on this side is responsible for the muscle on this side lifting up, right? So you
Mm.
might, so one of the tests, the Trendelenburg test, when we complete this, when we're doing this test, what we're testing for is when you lift the leg up, whether the hip is able to stay up or it falls, right?
Right.
Right? So when you have a weakness in this muscle, what you typically see is a hip drop as the person is walking. That's usually a sign that this muscle is weak. When this muscle becomes weak, what happens is that the adductors, which is the thigh muscles, the inner thigh muscles on that same side, becomes tight. Why is this important? Because this adductor muscles is also connected to the pelvic bone and is strongly related to the pelvic floor muscles. So the tightness of this muscle in turn can result in tightening of the pelvic floor. Also,
Hold
when
on. Take time. Take time. Take time with us. So, let's go over this. So the gluteal muscles, the
right, the
muscles in the
glute medius,
buttocks,
yes,
right? The muscles in the buttocks are important to stabilize the pelvis when you're walking.
right,
And you're saying that if the glute medius, which is one of these muscles,
mm-hmm.
um, is weak, then your body compensates by getting tighter in
Yes,
the
the inner
muscles on the
thighs,
inside of the thigh that pull the legs together.
right,
And those muscles are linked to the pelvic floor. And we know that
right,
because even when I'm doing an examination, you would say to the internal exam, you let the legs fall apart.
mm-hmm.
Because when the legs fall apart, the pelvic
The
floor
pelvic floor
muscles
muscles
will
relax,
relax to facilitate
right,
the examination. So, okay. All right. So now that some of us who not that quick as caught up, let's continue. Yeah.
right. So now these muscles are tight. So in turn, the pelvic floor muscles also tighten up, right?
Mm-hmm.
And so now you're working. So you might have someone who is not thinking about, so a practitioner who's not thinking about all these different areas of the body. And you're treating the pelvic floor, you're treating the person's pelvic floor muscles for tightness, vaginismus or some other condition related to tightness, dyspareunia, and you're saying, but the pelvic floor muscles are doing all the things, the pelvic floor muscles, they keep tightening back up. Why is this? Why is this happening? And it's simply because the glute medius, they're weak, the adductors are tightening, and they're in turn tightening the pelvic floor muscles. And that's how seriously connected everything is, and that we really have to pay attention to what our body is doing as a whole, instead of treating shoulder, treating back, treating hip, treating pelvic floor. You have to treat the individual as a whole, because everything is literally connected and everything affects the other muscles in some way or another. And this is actually called a cross syndrome. And it not only affects the pelvic floor, and this is why you'll have back pain. So we're not finished there. So what also happens is, because of the drop I mentioned before, the shoulder also drops to compensate, to even the head when you have the hike. So the shoulder on the side with the hike also drops to compensate. And now what we have forming at the spine, a scoliosis,
Mm-hmm.
a functional scoliosis, to
Mm-hmm.
compensate for what is happening at the glute medius. That is a direct relation to long sitting. So yeah,
So essentially, sitting for long periods is disrupting our muscular function.
right.
Um, and it's showing, and that's probably related to a lot of the pain syndromes.
That we have.
Yeah, that we have, because I've found that I've never seen so many cases of musculoskeletal pain, back pain, neck pain, as I'm seeing now.
And
you
in a
know,
younger population.
in almost 2 decades, well, over 2 decades by now, in medicine, I have not seen so many cases of muscular pain, and people are going to pain management specialists, people on muscle relaxants, people, you know, so, and I've chalked it up to generally the use of electronics.
Mm-hmm.
You're on your phone, you're always looking down all the time. So you have the back and neck related
Right.
issues,
Right.
and then of course the thumb and the carpal tunnel, and because you're constantly texting and typing, and then looking at the computer as well. I've chalked it up to primarily that. But you're saying now that the sitting may actually be
The
playing
sitting.
more of a role than we thought, even though we knew it was a problem.
Yes. Yes. It's playing a very important, well, a very tragic role in the
Mm-hmm.
pain syndromes. And it's something that we need to look into. I mean, a lot of the more established, or the companies with lots of money, they changed out their workstations to include standing desk,
So
so
I
that
need to be
person's
standing when I'm doing the podcast, then Kim, that's what you're saying? Eh?
I mean, our podcast not too long, so
From now on, I'm going to start standing when we're
you
doing the
should
podcast.
stand. You should stand for the podcast. We should stand and should go for a walk right after. But
Okay.
the problem with us is not just that we're sitting. If you look at other animals, once they get up, what's the first thing they do? They stretch.
Yes.
Uh,
Wow.
we
Come talk to me about
don't.
that. Yeah.
We
We
don't. We get
don't
up and we
anymore.
we
We
don't
don't
anymore
anymore because
because they
when
linked
we
it to
were kids,
laziness.
no, but remember, it's been, I think you and I have discussed this already. When we were kids growing up, and even now, you see kids now, they get up in the morning, what's the first thing they do instinctively? They stretch. And or
Yes.
if you wake up from a long sleep, but you realize as we get older and older, we don't do that anymore.
Because there were negative connotations to it. If you get up in your office after standing long and you come to in your office,
Lazy man,
somebody said it was lazy man, you're stress out. Stop putting laziness on me. Stop stress out the
Yes.
laziness on me. Yeah, that's what you're gonna hear. So the negativity that's been linked to it, that's the reason why people stop doing it. But it's actually good for us. And well,
Wow.
human beings, we have a tendency to shun things that are good for us. I mean, so now we have to do Pilates or go to yoga classes or
There's something that would
to
come naturally,
stretch.
right? Isn't that funny? Isn't
It
that
is
funny?
funny. It is funny. It
Wow,
is.
wow,
But
wow. So
I
who would have
mean,
thought that we started out talking about the pelvic floor and we're seeing it linked all the way back to just something as simple as getting up and stretching, that all of these muscles are connected?
all of these muscles are connected, and the if someone's listening, what I want them to take away from this is, while a lot of the pelvic floor dysfunctions are linked to laxity, a lot of the pelvic floor dysfunctions also linked to tightness, to muscles that aren't being properly stretched, and muscles that are unable to fully relax. And that's also very important because
Well, before you even take away, you're gonna have to develop that point though, because here's the reason why you're gonna have to develop that point, Kim.
sure.
Most of us, even as medical professionals, we are seeing pelvic floor dysfunction as, laxity, as you said. Most of the time, women who have symptoms like stress incontinence, prolapse, or even lack sensation that the vagina is not tight enough, they are told that they need to do pelvic floor exercises like Kegels exercises to tighten up the muscles.
Mhm.
But you are saying, and you and I have discussed this before, that the issue sometimes is not tightness,
It's not
well, lack of
laxity.
tightness, but an excess of tightness that is probably too
Right.
tight. So the
Yes.
question I'm going to ask you now is, I want you to expound on that. How is it that something can be too tight, but yet is manifesting itself with, vaginal laxity and prolapse? That's the first question I'm going to ask you to develop on. And then we're going to get into the solutions.
Right. So, so what happens, what can happen sometimes is that a lot of females, just like how we can hold tension in our shoulders, we can hold that same amount of tension in our pelvic floor muscles, right? A lot of women, when they get extremely upset, even men too, they clench their butt. You get upset, you get mad, you get stretched out, you tighten everything up, you clench for their life.
Clench.
You know, you're clenching, everything is rigid, and you don't even realize that that's happening. And so over time, what happens is that these muscles can become tight. And if you think of, so what persons sometimes think when they think of tightness, they think of strength. But tight muscles aren't strong muscles. Tight muscles are just tight muscles.
Ooh.
And in most instances, because they cannot move throughout the complete range, they're actually weak muscles, right?
That's
So
interesting.
think of your arm. So I like to use the bicep because we can easily see it. So think of your biceps. If your biceps could only move from here to here, would you consider your biceps strong?
No.
This is all you can do. So your hand would be here. You can't go all the way down here. You can't lift something and bring it up. It's not a strong muscle. And that's what happens to a lot of persons' pelvic floor. They've spent such time, if the pelvic floor should be able to move from here to here, and it's stuck here, and it's just going from here to here. How strong can that muscle be? Not very strong. Not very strong. So
that does make sense.
persons tend to think, oh, but my muscles, they're tight. I'm feeling everything. I'm feeling too much. So that cannot be my issue. Oh, but it is. And that is why it's important to assess what the problem is first. Because imagine a person coming in with incontinence, and we're assuming that, oh, it's laxity, and laxity is the main problem, and we start right away with Kegels. We exacerbate the problem, and we don't fix the problem. So it's not that we're not going to incorporate Kegels. It's just that we're not going to incorporate Kegels first. Because if you come to me with your arm all the way here and it's just moving from here to here, the first thing I'm going to do is get your arm to get as straight as possible, and then strengthen it within normal range. It's a muscle, so we treat it the same way. So one of my bones, or one of my grievances with the pelvic floor and other medical professionals sometimes is that they're prescribing random treatments, and not intentionally, of course not. But it's important that they become more informed, because it can actually make the problem worse. And it's one thing to tell a person to Kegels, but to be like, do your Kegels all day. Why? Why would you tell someone to do Kegels all day? You're not going to tell anyone to walk around with a dumbbell and curl their arms all day. But it's a muscle. It's a muscle similar to any other muscle. So, you have protocol, you have reps, you have sets, you have specific instructions that you need to follow in order to strengthen these muscles effectively. So, appropriate collaboration is necessary. I know I'm preaching to the choir, but it's important to say.
No, I think it's really important though, Kim, because what the truth is, I can tell you, for the average gynecologist, the extent of training, even gynecologists, I'm not talking about general doctors, because I imagine it's going to be less. The extent of training on pelvic floor is really, from a therapeutic standpoint, Kegels exercises, general discussion on biofeedback, techniques, and refer to pelvic floor physio. So the truth is, even when the gynecologist is referring for physio, he or she does not know what he's referring for really. And so, and it sounds sad, but it's the reality.
It is the
So yeah,
reality.
the assumption is that the physiotherapist is going to know what is needed. But you're saying
Yeah,
that the key thing is that we have to be first diagnose the problem before making the recommendation.
you don't
Is it
have to
laxity or is
diagnose,
it?
right? But you don't have to diagnose or make the recommendation. You just need to send the patient to the pelvic floor physiotherapist.
No, no,
That
no.
is,
I'm saying the physio needs to know,
the physio
make the
needs to know.
diagnosis. That's what I'm saying.
Needs to make
I
the
mean, I don't have a
diagnosis.
problem in sending the patient to the physio,
Yeah.
but now it's important that, because if I'm sending a patient to another colleague, I'm not
Mm-hmm.
referring. When I refer patients, it should not be that a doctor is referring a patient because he does not know at all what the patient is going to benefit
Absolutely
from.
not.
You're
Right.
referring to
Absolutely
a
not.
colleague because I think you need X, Y, and Z, and this
Mm-hmm.
person is more equipped based on experience,
Right.
based on expertise to
Mm-hmm.
provide you with X, Y, and Z. That's what a
Right.
proper referral involves. It's not
Absolutely.
so the point I'm making is that what you're saying is so important because as a physician, I need to know that my patients understand that when they're going to the physiotherapist, there's going to be a diagnostic process here to find out
Right.
what's happening. And it's not just
Mm-hmm.
about Kegels.
Right.
You see, because that's important. Because many
That is
patients may
very
not go. If they
important.
think all you're going to do is tell me I'm going to do Kegels,
They just look it up.
then I'm going to look it up online. I'm going to do it. Anyway,
Right.
sorry to say.
No, you're right.
Yeah.
That's it.
Most of us can grasp the issues. Let's get into some solutions now because somebody is saying, well, doc, and I want to deal with prevention as well as preventative treatment as well as therapy. Okay.
Mm-hmm.
So and when we talk about prevention, we're talking about the person who is either that first group or the second group you mentioned, meaning that either
Yes.
nothing is wrong or there's something off, but they're not having symptoms. How do we prevent those patients from getting to the point where they're decompensating?
I love this
Let's start with
question,
that.
Doc. I love this question. I like it because we truly believe that an ounce of prevention is
It's
more than a
better
pound
than
of
a
cure.
pound of cure, right?
So we have to definitely incorporate more preventative measures into medical management as much as possible. As much as possible. So the first thing, it's from your young girls. I have a 7-year-old daughter, and I know I'm sorry if it feels like I'm just focusing on females, but as you point out, the
Sorry, you're making me feel, I feel bad now, like I have to stand up when I do that.
okay, I see when they stand up.
I feel
You're
like I need
worrying
to
about your
stand up now.
gluteus medius. You're worried
Yeah,
about your gluteus medius.
I already have my back issues already, so I'm sad. Anyway,
Like
go
I've
on. Let
been
me be
sitting
for a
for an
second.
hour now. I need to
Yeah,
stand up.
yeah,
I hope somebody listening feel like they need to stand up.
I'm gonna next time. I'm definitely gonna find a way to stand at least up after a while. Yeah. So yeah,
Right.
so
So
prevention.
right. So I'm sorry if it feels like I'm focusing more on females, but you know
That's fine. We're the women's
the
health doc, and you're the women's
consequences,
health
right?
female, women's health
I
physio.
just want to
So
make sure. So one of the things that we tend to do to little girls, we're going on the road and we say to the little girl, go and pee just in case. Because I don't want you to go up on the road and ask me for use no bathroom. If you ask me to use the bathroom and you're
what am I
on
going
and
to do?
on
What
and
am I going to
on,
do?
what you going to do if you even ask me to use the bathroom, right? I will go
Right.
on. So what that child does is they go into the bathroom and they don't really need to pee, but they're not so terrified that they're going to ask you to pee on the road that they go in there, sit on the toilet, and they strain
Mm,
and try to force out some pee,
right.
right? And that is where it begins. That is where that pressure
Mm.
on the pelvic floor, that's where it starts.
So the
So
forcing to pee is not a good thing.
we're not forcing persons to pee. The body has a system where the brain says we need to go. You go to the bathroom, the muscles from the sphincter, they automatically get the signal from the brain, they release, and pee comes. There's a system, and we need
Mm,
that system to work. Because what happens over time is that now your body don't know how to use that system. Your body starts to pee when you're not even, you want to pee when you're not even in an area that you're supposed to pee.
That's
Because
interesting.
you've taken over that, you've turned what's supposed to be an involuntary process into a voluntary process. Or, yeah, right. So it's very important that you allow the persons to pee when they need to pee. So if they need to pee on the road, you need to just find a bathroom on the road to pee on the road.
So the
Right. So
first
we
thing
don't
is we have to be careful about that whole culture
of timing the
of
pee or
timing.
forcing the
Okay,
pee
okay.
or whatever you call it. Time
Right.
training, whatever they call, they have names for it. We're not doing that. We're not doing that.
Let
And
PB
then
free wherever it may be.
not on your clothes, but yes.
Whenever it may be.
And then 2, issues with constipation. We want to make sure that we're incorporating enough liquid into our diet. We're drinking water as we should. We're drinking our 8 glasses, or what was that measurement again, doctor? I can't believe I forgot it. Half my body weight in ounces.
Yeah. Yeah.
Right. Drinking the appropriate amount of water so that you can effectively pass your stool. Also, eating fiber, taking in enough fiber, right, to also help with passing your stool. So we don't want any straining again. So if you find that you're only going to the bathroom to pass your stool 2 times a week, that's a no-no.
Okay.
That's a no. We're aiming for at least once a day, or at the very least 5 times for the week, if you're not passing daily.
So the first thing
Right.
is, so generally any straining it should be avoided. If it's, whether it is straining to pass the urine when you don't need to, or it is straining to pass the stool, we need to find a way to make that process strain free. Okay.
Strain free, because it's during the process of passing pee and stool is when the pelvic floor is relaxed. It's supposed to relax and things are supposed to just make the way out. The body is made to just let it out. So if you are you're forcing against the pelvic floor not relax, you're pushing against, you're damaging the muscles
and the nerves.
And the nerves.
Which is similar to what happens in pregnancy when you have the weight of the products of conception pressing down on the, okay.
Because now you have these organs that the pelvic floor are holding up, pushing down into the pelvic floor.
Right. I get you.
Right? And then, so we spoke about the passing of the urine and the bowel. What's my next one? Breathing exercises. So we want to, if when I say take a deep breath in, you're sucking in your tummy,
like
Dr.
mine,
C.
Like mine. I say after trying to retrain my pelvic floor now, I'm training it now, right now as we speak.
So the idea is on the inhale, the pelvic floor and the tummy, they're relaxed. And on the exhale, the tummy and the pelvic floor, the tummy goes in, the pelvic floor pulls up. It's a gentle pull. So as women, we need to take moments out of our days to listen to our bodies, to feel. Just close your eyes and visualize the process. And if you do this often enough, I promise you, you will begin to notice and feel the pelvic floor muscles. Right?
Yeah.
So that's one very important one. And 2, wait, I had another one that very important. Let's talk about the breathing, the pelvic floor, noticing the pelvic floor with the exhale. It'll come back to me. But the next one I'm going to mention is if you start to notice that when you sneeze or cough, you're bearing down or pushing in, you're bearing down or pushing into the pelvic floor, that's generally a sign that something is happening and you probably need to seek help. Also, okay, it's getting really windy. Also, if you're having sex and you're having pain with sex, this is usually a sign that something is also happening. with the pelvic floor and you need to seek attention. This is not necessarily might not necessarily be a pelvic floor issue. It might be another gynecological issue. So definitely go and seek help to find out exactly what is happening and have it treated appropriately. All right. There was something else, Doc, something very important, and I cannot remember it.
Is it flexibility and stretching? Because we had mentioned that, I mean, certainly the tightness in the adductor muscles
With the
contributed
sitting,
to that. So how much does stretching on a whole and play a role in prevention? And if so, what kind of exercises?
that was the angle. What I was going to say is ensure that you're not clenching the butt throughout the
Okay.
day.
So I have a check to make sure let me make sure I'm not clenching.
Notice what happens to your body when you're stressed. Again, it ties in with taking moments to notice what is happening with your body. When someone upsets you, when a person bad drive you on the road, what do? Where do you hold your attention? Notice this so that you can then work on these areas, because tightness anywhere is going to cause some compensation elsewhere, right?
That's interesting. So you're saying, so does the stress, just managing stress is going to have an impact on this?
Right, to help you to relieve some of the tension.
Right.
Now, one of the most important stretches is a figure 4 stretch, and I'll try to explain it as best as possible. It's basically sitting on a chair, and you want to make sure that you're sitting on your bottom bone. So you want to feel the bone on the bottom
So I
directly
can
on the
sit back on the
chair.
chair now.
Yes, you can sit back on the chair. You can do it, Doc.
All right.
Right? You want to make sure your bottom bone is directly on the chair. Ooh, what is happening outside? And you want to cross the right ankle over the left knee. Right? So cross your right ankle over the left knee. Say like it's a cut 10. Yeah, like you're cutting your 10. Right. And then you can gently press down. I said the right ankle over the left knee. So you can gently press down on the right knee. Right?
Oh, okay. Like I'm feeling a stretching in my hip.
Right. And you lean forward slightly. So you want to keep your back straight. So lift the chest as you lean forward. And that will increase that stretch that you're feeling in your hip. Right?
Right.
And that's the stretch for your gluteus medius, right? Because remember, we want this muscle to work efficiently so that the adductors don't tighten up and we don't have tightening of the pelvic floor. So people might say, Kim, so why don't I stretch my adductors? Yeah, we can stretch our adductors. But the important thing is that the glute medius functions appropriately, because that's where the problem lies. So you have to fix the root cause.
And you did say that if the muscle is not adequately stretching, it is weaker. And the underlying problem is weakness of the gluteus medius.
Right.
Excellent.
And then a big strengthening exercise for the glute medius is clams. Clams. I hate clams. But it's so effective. So clams are essentially lying on your side. So you're inside lying. I don't think you can do this one, Dr. C. So you're inside lying, right? And you want to make sure that you're aligned on your side, shoulder in line with the hip. And then the knees are slightly bent. Heels are together and you're opening and closing at the knee. You want to make sure that as you're opening and closing at the knees, you're not rotating your lower back, right? You want to make sure that your hip stays stacked, one above the other, and you open and close at the knees. And that is excellent for strengthening glutes. Another pretty simple one that I can show you right here, because I can't stand up now. Might have to hold my mic though, because mine not as long as yours, Doc. Right. A pretty simple one is, whoa.
All right, sorry. My apologies. I didn't.
So there we go. Okay. Right. So you stand against the wall. You seeing me? Right. You stand back up. Right. You stand against the wall. And while you're against the wall, so if you're trying to strengthen this glute med, So if you're trying to strengthen the right glute med, you're pressing the left hip into the wall, right? Because remember, it's when the left leg, part of the function of the glute medius is to help the left side to lift up, to lift out into abduction, right? So you're pressing the left hip against the wall to strengthen the right glute medius, right? Right. Very, very, very effective. So it's kind of isometric, not a lot of movement actually happening when you're doing it. You're just pushing against the wall.
Okay.
Nice strengthening exercise for the pelvic floor. Along with, of course, Kegels, once you've worked on relaxing the pelvic floor muscles. And then if you really think you need help, then you should definitely reach out to a pelvic floor physiotherapist to at least get an assessment, because as I said, most persons fall in one of three categories. And if it's three, the chances of falling in two of the other ones that need help, it's very great. So reach out to a pelvic floor physio.
Oh, that's good. That's good stuff, Kim. Let me see. One last question regarding the relaxation. Are there any techniques to help to relax the pelvic floor?
Yes, there are techniques to help to relax the pelvic floor. And one of my favorite ones is to just grab a towel roll and sit on the towel roll. So you're aligning that towel roll with the vagina. So you're literally sitting on it, and you want your vagina to make, you can have on clothes, guys. You don't have to be naked. But you just want the vagina to be making contact with the towel roll, right? So a small towel roll is efficient as
So it's
well.
in between the legs, is it?
And you're sitting on it, right? You're
Okay.
sitting on the towel roll. And what you're trying to do is when you take
No,
that
the
deep breath
reason I'm asking
in,
that is that the towel roll can be between the legs or it can be across the glute, the buttock. Is it is it parallel
it's
to the legs or it's perpendicular to the
parallel,
thighs?
parallel
Parallel
to
to
the
the thighs, so
thighs.
it's in the middle.
It's in the
Okay.
middle, right? So it's like you're sitting on the towel roll,
Right,
but
right.
like this, right? And when you take a deep breath in, you're trying to lengthen the pelvic floor into the towel roll. And as you exhale, you're trying to lift the pelvic floor off the towel roll, right? Right. So as you take the deep breath in, you lengthen the pelvic floor into the towel roll. And as you exhale, you lift the pelvic floor up off the towel roll. And that, along with the stretches, are usually pretty effective in terms of relaxing the pelvic floor muscles. There are, of course, a lot of other stretches that you can do, because you do want to stretch the adductors. But the key thing is, if the glute medius are weak, if you're not strengthening the glute medius, you stretch the adductors from morning till night, it's not going to be very effective, because once you start walking again, the compensation happens and the tightening happens again. So the key thing is to make sure that if your glute medius muscles are weak, you're strengthening them. And if you're sitting more than 3 hours a day, chance of your glute medius muscles need strengthening, it's very high. So that is where I would start. But while you're strengthening, it won't hurt to also stretch the other muscles that are tight.
Okay, guys, so you hear that. So if we're not strengthening the glute medius, we can do like some clams. We have to do that along with stretching them as well. So both
Right.
strengthening and stretching. And we
And
spoke about
the isometric against the
and
wall, very important. It's even more effective than the clams,
the
actually.
clams.
But it's just important that you're actually doing it right and you're in proper alignment. But the clams easier to get in alignment than
Nice.
the standing against the wall.
All right. So if you're having symptoms, pelvic floor dysfunction, then you definitely need to see somebody. If you're not, then and you plan to get pregnant, you should consider seeing someone,
You should.
and you should consider incorporating some of these exercises and these stretches. So, Kim, listen, this was fun. This was good stuff. I enjoyed it immensely. I'm sure our listeners are going to be greatly benefited by it.
They will
So,
be.
and as usual, great chatting with you.
As always.
All right,
So
guys. So, guess what? That's us for today. And stay healthy and stay what, Kim? There you go. How we say?
Stay healthy, stay happy.
Stay happy, stay healthy. All right, guys, that's it for us. Take care until next time. From me, Dr. C, and
Everybody have fun.
Women's Health Physio. Blessings.
All right.